Hello and good afternoon, everyone. Welcome back to Health Careers Live, to the AHP stage. This afternoon, we are going to be discussing AHPs working in a community setting. And that's really important to us because often when people think about careers in health and care, they often think about a hospital setting. And actually, so much of the fantastic work that AHPs do happens outside of a hospital setting, in the community. So before we get going with our questions to discuss this a little bit more, we'll introduce you to our fabulous panel this afternoon. My name's Vicky. I'm a physio, and I've got lots of experience working in different clinical settings, and that includes community settings, usually community rehab settings. So I'll hand over to Carrie.
Hello, my name's Carrie Biddle. I am a speech and language therapist by profession. I live in Cornwall and I have got 20 years experience of working in the NHS, and I've spent a lot of time working in adult services out in the community, working in palliative care, working with people that have had strokes, who have got long-term conditions, people with voice problems, and have also spent some time working overseas where I work with children in the community.
Brilliant. Thanks, Carrie. Over to you, Pip.
Hi, everyone. Good afternoon. My name's Pip Watson. I'm a therapy practitioner in Milton Keynes, and I work with adults with learning disabilities. I cross-cover physiotherapy and occupational therapy, and I've been a support worker now since 2012.
Brilliant. Thanks for joining us, Pip. And Vasiliki, over to you.
Hi, everyone, and good afternoon. My name is Vasiliki Papadopoulou. I'm a third-year student at Glasgow Caledonian University studying human nutrition and dietetics. I don't have much experience yet, but I have a lot of excitement, I guess, for dietetics.
Fantastic.
Share that with you today.
Thank you. So we'll start just by having a little bit of a think about the general benefits of seeing people outside of a hospital setting. And from a physio point of view, the thing that's really important to me is that it makes rehab really relevant. And a really nice example that I can give you of that is that, like Carrie, my profession also means that I can live and work abroad. So I spent lots of time living in New Zealand and working out there. And I lived in Wellington, which is really, really hilly. And so patients would come into hospital, whether that was with injury or surgery or an illness or condition that affected their mobility. And in order to get them home, they often had lots of very, very, very steep steps to either get in or out of their property. And that's really hard to replicate inside a hospital environment. So we would enable these patients to get home, and then it would be down to the community team to practice their stairs with them at home to enable them to access their community and get on with the rest of their lives. So for me, that's what it's all about, really. It's about making our rehab and our intervention really relevant to that intervention, to that individual, sorry. Vasiliki, do you want to tell us a little bit about why you think what the benefits are of working in a community setting? Oh, you're on mute, Vasiliki.
Sorry, I forgot I was on mute there. I just feel the need to kind of disclaim that, unfortunately, because of COVID, I haven't been on placement yet. So my experience would be more like kind of my opinion of what I think it would be like. And I think I kind of want to echo what you said, Vicky, because I feel that in a clinical setting, in the hospital, things tend to be a bit more urgent. We don't have the time to kind of spend with that person and understand their lifestyle, and maybe that would give us some more like a more holistic assessment in a way that we can offer this person-centered approach and treatment and help in a much more, I feel I'm repeating myself, but yeah, help in a more holistic way.
Yeah, I completely agree, Vasiliki, and I think I'm thinking about the community setting in terms of being in people's homes. And certainly, I think once you step foot inside somebody's home, you see the entire individual. It's so much easier to put yourself in their shoes when you might meet their family and you meet their pets and you really see who they are and what's important to them. And I think that's quite a special thing to be part of, actually, as a healthcare professional. Pip, over to you.
Hiya. For me, I think it's doing that one-to-one rehab with the person within their own home, similar to what Vicky said. You build up a better rapport with someone, whereas when you're rehabbing in a busy hospital ward, it might be for only 5, 10, 15 minutes, and it's not very individual. It's more like you're getting through a list of patients, whereas when you're in their own home environment, you can see the things they like doing, the things they don't like doing. You can adjust to that person's need. I also think when you're at home, you're less prone to infections. So you're in your own bugs, so you're not mixing with others. You've got your family, you've got your friends around to support you. The hospitals are very busy. They've got restricted times. We've all been there. So I think it's really nice that the patient gets that time. And there's so many services that can go into that person's home. There can be physiotherapists, occupational therapists, carers that we liaise with, support providers and managers. And you can really build a good team around that person to get to whatever their goal is. And you're more likely to reach a person's goal at home than you are in a hospital setting. And that's why I'm quite passionate now about the community and staying in the community. But I did learn a hell of a lot in the hospitals, and that's where I started. So I've sort of brought all them skills, which I'll go on to talk about in a little while, into the community, which have now helped support workers and managers to identify clinical needs of people. So actually, community is the way to go. I love it. So yeah, that's me.
And I think, you're quite right there, Pip. There was a panel member that unfortunately couldn't join us today, and she's a passionate community physio. And she said, actually, a lot of the time when you're working in the community, it's about keeping people out of hospital. And again, I've got another good friend who talks about when patients are in hospital, we shouldn't talk about the number of days that they're in hospital. We should talk about the number of days that they're away from being at home, wherever that may be. And so it really it's quite a privilege to be part of that, isn't it? To support people within their own environment and keep them out of the hospital setting, which, as you say, often isn't the best place for people to be. Over to you, Carrie.
So I'm going to take the baton from what Pip was saying, because I think she made a really great point about being part of a team around a person. And I think you default, well, first of all, I'm going to be brutally honest. I'm nosy and I love people. So you get to meet people in their true sense and in their own bugs, as Pip said, their own space, how they live, what's important to them, what motivates them, what they're really going to do, what really drives them when you're in their own environment. So, it's a fantastic place to be, and it's lovely to be on someone's team and to think about how you're going to support them to achieve what's important to them. So it is different experience. You have a different relationship because you do generally tend to see people for longer than you might do in a hospital setting. And potentially you see them, hospitals, people are poorly and they're unwell and they need care, but they often need those things to recover or to prevent them from getting unwell and to keep them well in the community. So it's a slightly different stance that you can take when you're supporting people and empowering people to be their best selves when they're at home, being in a community setting. So I loved it. And being out and about, I worked in outpatient clinics, I worked in centres, I've been out into people's work environments, I've been into school environments, into their homes. So you get to go in a raft of different places. So if you like being on the move a bit and you don't necessarily want to be in a hospital building setting, there is so many other places that you can be and work.
Yeah, I completely agree, Carrie. And that's something I've always loved about being in the community is sort of being out and about. As a physio, we like to be on the move, and working in the community, that's quite literal. You can drive all over the place, which is as you say, it's great being nosy as well, getting to see different people, different environments. Okay, so I'm going to move on a little bit and direct a question towards Pip, who I know was working clinically throughout the pandemic. And we know that was a really challenging time for many people in society, and particularly people working in health and care settings. But could you tell me a little bit, Pip, about how your team managed to adapt the service that you were providing to make sure that the people in the communities that you were treating weren't affected too much?
Wow, we got a phone call, and it was a Thursday morning, March the 20th. I remember it so clearly. So with our adults with learning disabilities in Milton Keynes, we used to have a gym. So we'd have a venue, and they used to come to us every single Thursday morning and Friday morning for an hour and a half, sort of shoving them out the door, telling them we've got more appointments to go to. They loved it. On that Thursday morning of March 2020, we received a phone call and floods of emails telling us not to open the doors to these people. Now, this gym had been open for 15 years. So they didn't understand why we had to close the doors. We hadn't really had much information about COVID. It was all sort of coming out. They didn't know why they weren't allowed in the building. It was a bit stressful for them, actually. But luckily, we got them back on their buses, or parents or carers were able to take them back to their homes. So we had about a week to think, how can we see 20 people across 2 assistants and 2 therapists? What we done was we prioritised our patients. So we categorised them into 3 categories. We saw the people that were most severe, to the ones sort of mediocre that you could see a couple of times a month, but their support workers could also implement their physio programs. We encouraged support workers, family and carers to do what they could, but there were certain people that we had to go in. It took a little bit of persuasion from managers to let us in, but with the correct PPE, I mean, some places we were in hazmat suits, the children's places. Other places we'd have to wear double masks, double gloves. So we were really careful. We were doing lateral flow tests every day at that point. And we were really lucky as a team. We only got COVID last year at Christmas. So pretty much for the 2 years, our team were pretty healthy. And we asked for some funding, and we said, we need kit bags. We need stuff in our cars that we can take to people's houses. We can't just tell them to do these exercises on this sheet. It doesn't work like that with our guys. So we got bean bags, we got hoops, we got TheraBands. We've got all sorts. We were actually trying to swap our bags around because we've had them for a little while now. So we're sharing bits of equipment. But again, we had the proper PPE to clean it. We had proper wipes, sprays. So you see us in the streets spraying our bags. And we had big gym balls that they could use. So we tailor-made sort of home programs for people. And we actually saw a reduction in falls within our service throughout the 2 years, because we were actually giving them more than what they probably had previous to COVID, but we had more work, which is fine because we love our guys and we'd do anything for them. So yeah, it was a massive learning curve. We support people on big campsites as well. So these guys, there's a couple of sites I support, and there's up to 50 people, and they all share flats. It's very communal. We're all happy. We all go out on walks together. And when I turned up to one certain chappie, he was doing fine from my point of view, but the staff are not clinically trained. So I was able to use my skills to help another resident that was actually quite poorly on that site on that day. And they said to me, Pip, would you take a look at so-and-so down at number 50? And I said, yeah, sure, while I'm here, you know. So I popped down to this little lady, and she was very poorly. She had COVID, and she went away in an ambulance, and she recovered within about 3 or 4 days, and she was sent home. So we still have her, which is great. But I felt like I could give something to them to say, actually, let's do her blood pressure, let's do her respiratory rate, and let's just make sure she's okay. And luckily, she got the help she needed. I think I was in the right place at the right time on that day. So yeah, we've adapted, and we're still using some of them one-to-one sessions, but we've also gone back to some of our group sessions, which is swimming, which I love. And I swim about 4 times a week with them. And that includes special needs schools as well as adults. We take on from 16 in the community in Milton Keynes.
Fantastic, Pip. Thank you so much. I've heard so many wonderful things there, and I think, you know, the things that really resonate for me there are that AHPs work fantastically as a team. You know, you talked a lot about the team there, all working together, and as a team, you're resilient, resourceful, inventive, you know, coming up with new ways of working with literally hours to spare. But I think really the thing that that resonates most for me is how you're always putting your the people that you're treating first. You know, they're at the center of everything, and all of those examples that you've just given there are about helping those people be the best people they can be. Right. So a different question for you, Carrie. We talked a little bit about the benefits of working in the community, but where would you say the best place you've worked is? What's the best community setting you've worked in?
Ooh. So I've probably got a couple, so I'll be quick. So I was very fortunate when I went travelling shortly after I graduated. So I went straight from school to university, got my qualifications, went into practice as a newly qualified speech therapist for 2 years, and then went off and did a gap year and went travelling, but was able to use my qualification to help fund my travel while I was away, and headed to Australia. And I was very fortunate to live and work in Cairns in Queensland. And I serviced the Torres Straits Islands, which are a cluster of islands between Australia and Papua New Guinea. So I was part of a visiting specialist service. So we would fly out at the beginning of the week and fly around different islands, one of them being an island, true story, called Coconut Island. I mean, you couldn't make it up. Beautiful places. An indigenous population, the Torres Straits people are the second indigenous population in Australia. So massive cultural changes, massive differences. But again, working out in the community and within their local island communities, it was very much taking that person-centered and functional, what really mattered and how could we help and support them approach to working with children that had specific communication and learning difficulty needs. So that was an amazing place and different experience to work in. I think I was more of a novelty to them than anything. They didn't, with me blonde white hair as I had back then, coming in with this funny accent, and the word would spread around the islands that the funny one was coming. So, you know, there's an expectation there when you turn up, but it was wonderful. It was a really exciting and brilliant opportunity. I suppose my other ones that I've really enjoyed is where I've got to work in a real team. So I worked in a stroke service, and we had quite a number of people that were younger people and going back to work. So we would help that transition back into the workplace. So I would work very closely with the physiotherapist and with the occupational therapist, and we would go out and do like keeping in touch days that you would have going back to work to review the environment, to think about what was needed, to think about how they were going to work, what adjustments needed to be making to support them to work, what do we need to work on to build their confidence. So yeah, some really different but great examples, I hope, of places to go and people to work with.
Fantastic, thanks, Carrie. And that's a similar theme to what Pip was talking about as well, isn't it? About working together as a team, and I think that's particularly important and valuable in the community, is having team members that can help you problem solve and help you really get the best for the people that you're treating. So thank you for that, Carrie. So Vasiliki, we've talked so far about the community setting, largely in terms of seeing people in their own homes, but I think we could probably think about the community in a much wider sense in terms of influencing and educating people in society. So I'm really interested to hear a little bit more about what led you to want to be a dietitian and what your vision is in your role as a dietitian.
Yeah. I hope you will allow me the luxury of my notes, because I know I have so much to talk about, and I sometimes I lose my words, I guess. But I think the first thing that kind of maybe the catalyst was me having a bad relationship with food and struggling with disordered eating. And during my recovery, I would look up online and try to educate myself and understand the science behind nutrition. And as the time passed, I realized, oh, there's so much going on online, and there are so many misconceptions. Everyone is looking for this magic thing that will fix your life, and if it is this magic diet or this magic detox tea or things that some industries have taken and put this label on. I used the word holistic before, and sometimes this word tends to be associated with another kind of non-evidence based industry, I guess. So what led dietitian was I wanted to understand what is true. What is true about the science of nutrition, because there's so much online, and everyone has an opinion. Everyone knows things they know the best. Well, getting an understanding of the actual science, I guess, is just so liberating. And so I just want to let everyone know. I just want everyone to see. The word education is a very important to me, but not education in a didactic, like kind of parental, I know best way. More in terms of empowering that person to know where do I look for information, who do I speak to, what is the correct way of going about treatment or advice or anything like that, because people tend to kind of feel more comfortable following this influencer online and following everything they're doing rather than going to a professional and ask. So I guess my vision is that I will empower people in that way one day, and I will help people in terms of just empowering them. And there is also this part of all the misconceptions that are out there is, the thinner you are, the healthier you are, and the other way around. If you're not thin, you're unhealthy. And sometimes it kind of breaks my heart a little bit when I say I'm studying to become a dietitian and people say, oh, we're gonna need you, how do I lose weight from this part of my body? What do you think about that diet? Because people think that's what we do, that we help people lose weight, and that's all, everything that we do, which is not. But another part that makes me a bit sad is because almost 100% of the times when I say what I do, I get this reaction, and everyone is so included, me included. I'm not, I get affected as well, but everyone is so affected by the beauty standards, the weight stigma, all these. I keep using the word misconception. I don't know if there's a better one, but yeah. And yeah, sorry. Yeah.
Sorry, I don't want to interrupt you. I could listen to you talk all day, Vasiliki, because it's clear that you're really passionate about what you're doing and why you're doing it. And I mean, a couple of things that really stood out from what you're saying is talking about empowering people and empowering people around decision making, and that's a really important part of what AHPs do and all healthcare professionals do. Really is. As you say, it's not educating to teach people and make them understand. It's to give people sort of informed choices and to feel in control of their care and their lifestyle, I think. So that's really important too. And I think we talk when you're sort of talking about misconceptions and things, we talk a little bit about myth busting sometimes, and that I think that happens to a certain degree with lots of AHP and health and care careers, is people thinking they know what we do, but they don't really. And so, as you say, it makes you sad that as soon as you say you're a dietitian, people say, oh, well, that's great because I need to go on a diet. It doesn't make me sad, but from a physio point of view, the equivalent is, I say I'm a physio and people go, oh, can I have a massage, or I've got a bad back. We do a lot more than that. And we're really passionate about making sure that people understand that physios do treat people with a huge range of conditions, and it's not just about sports injuries or bad backs.
Yeah, no, definitely agree. And something that, when I say it makes me sad, it's more that people tend to focus so much on weight, and there is a relationship with health.
Yeah,
obviously. Sometimes it's not the cause, and I wish that there was a bit more acceptance, and disordered eating, for example, right now is like, I saw something online the other day. Someone talked about how it's everyone is doing it, so we now think that it's the normal. It's like the yeah, and yeah. Sorry, I can talk about it all day. I know we have
no problem at all. Thank you. So just moving on a little bit, and talking to you all a little bit more about your wider roles. Pip, I know you've mentioned before to me about your lead support worker role within your organisation, and I'd really like you to tell us a little bit more about that, what the role is, and sort of what you enjoy about that.
So I work for a trust in London, but it's spread out across the country. It's a bit of a strange one. It's the first one that I've ever worked for that we're not all in one place, so I had to get used to that. Last year we were approached by some of our senior lead management people down in London, and they were asking whether or not we would like to take part as a Health Education England project, and it was about exploring what support workers they have in the trust and whether or not we could work together, collaborate with each other to then sort of try and network our support workers across the trust. We have had some input. I'm not going to say we've done it, because we haven't, because I have my own job and then I do that role one day a month, so it's really limited time, but a lot of work goes into that one day. And we've developed resources for our support workers on our TrustNet, so they can look at learning development, careers, and how to get onto apprenticeships. There's been so much done that, to be honest, I haven't had enough time to look through it all. But our main thing for our trust is getting everyone together and building up a community of support workers, whether that's across the trust and we meet at a conference once a year, or we're going to talk about, our event is in November. There's 3 of us leading it, myself, Aaron Miller and Caroline Toes, alongside our lovely support managers. And we're going to talk to our support workers and see what they want. Like, some people might be happy where they're at, and we don't ever want to make people feel like they have to move on or they have to progress, because some people are content. They like their 9 till 5 and they go home and that's it. But there are some other people, whether you're younger or a bit older, that want to develop and build their career in different ways, and they want to explore different paths. Years ago, there wasn't the opportunity to do this. But if you're all out there, I would take this opportunity while it's there. If there are apprenticeships in your area, you can earn money while you work. You can earn a qualification and be paid at the same time. So you're getting a bit of a wage, but at the end of it, you're getting that qualification, which can lead on to lots of other pathways. So really explore your opportunities. That's what I would say. If you take anything from this today, explore your opportunities, look in your local hospitals, look in your local community, Google which is the local education authority, have a look at a lot of trusts have an education department. So you can always ring up their switchboard and say, hi, I'm just ringing up. I'd like to speak to education in this certain area about any opportunities. I'm hoping that my goddaughter's on this call today, Macy. You can also start with bank work in hospitals. So you can start as a band 2 and you can pick and choose your hours. Nurses always appreciate good healthcare assistance. And again, it's like we were saying earlier, if you've got good staff, a good team, we get great patient care and we get great feedback. A lot of the NHS feedback is not great. We see it on social media all the time, this and that, but there is a lot of hard work and a lot of happy stories that go on, and it's so rewarding. I don't think I will leave the NHS, just put it that way. I'm happy and I'm content where I am, and it's security. You get great annual leave. The longer you're with us, the longer you get holidays. I've got my maximum now, which is great. So yeah, really explore your opportunities and get in contact with your local hospitals, education departments.
Brilliant, thanks, Pip. And that brings me on really nicely. Actually, we had a question in the Q&A from one of our sessions earlier on in the day, and it was asking about any top tips for interview prep, and as you were saying, Pip, there, sort of how to find the roles that might suit you, you know, ways that you can sort of get the experience or get further training. Do you want to come in on that, Carrie? Any sort of top tips around exploring roles within AHP careers?
Yes, so I think, so the question we were asked was around band 2 and band 3 roles. So these are in the support worker space, but actually the top tips I would say are the same across. And again, I'm going to take my lead from Pip here. Do some research, find out about what's available, think about what you enjoy doing, think about how you like to spend your time and what you think your strengths are. Don't be too worried about what current qualifications you've got. You are more than what your qualifications say on paper. You have much wider skills. So we've talked about being able to be creative, being able to be a good problem solver, being able to be a good team player, being able to get through work and move on to the next thing, being able to cope with multiple different asks of you in one place, being able to be mobile, potentially being able to drive. Some of these wider skills are very important if you want to work in the community and or in a healthcare setting. And any role that you're looking for will have an element of training and support that comes with it. And I would expect and love to see, as Pip said, there's great opportunities and more coming in to support and grow and develop people once they're in roles. So you don't have to be the finished package, but what you have to show is that what's important to you is important to them. So thinking about your values, and most organisations will have values. So have a look at their values. If you think what they're saying matters to you, then they will probably be a good fit for you for where you want to work. Have a chat with someone. Most, and I'm going to say all, but I'm going to clarify that with the most jobs, when you apply for them, they'll have a contact number and someone you can actually talk to about the job. Sometimes you can even go and have a look around. So take the time to do some work, have a look, speak to people to find out what it's about so that you can come prepared, and be prepared to share what your strengths are. You know, we've all talked about things that are important to us and what we're proud of for ourselves. Share those, because those are your gifts that you will be bringing to your team that they will be able to tap into.
Brilliant, thanks, Carrie. And Vasiliki, you're still sort of in the training and education part of your journey. Do you have any top tips, having recently lived it, in terms of things to think about when you're considering a career as a dietitian?
Well, I think this question kind of links in with what I talked about earlier. We are all affected by when we talk about dietetics and nutrition, we are all affected by diet culture. We're all affected by what we think we know. So I would say to anyone that is thinking of a career as a dietitian, be open-minded. Because you're there to learn. You're not there for your views and opinions to get confirmed. right? So you might learn something that actually doesn't really go with what you think you knew before. Especially in the field of nutrition, there's so much information out there, and everyone thinks they know better. And I had to learn that on the course, because I had some misconceptions myself. And another thing that I would say, this is with my like student hat on, do your research and try and understand what the profession is about. And when you apply for any university, go look on the requirements, because I like sharing that story, because I feel it's so powerful for potential students in healthcare. A year before I got accepted in GCU, I had to go to a college to get a few extra qualifications so I can be on the same level with my peers. Someone on that college told me that I wouldn't go to university next year. It was just the hard answer that I had to accept, that this dream wouldn't happen. But having had sorry, my grammar wasn't great there, but having looked on the requirements, I knew I could do it. I knew I had the qualifications. I just needed something extra. So if I had listened to that person back then, I wouldn't be here today. I wouldn't be able to share my passion with you and everyone that is watching, and I would have missed on so many opportunities. So the point is, like, do your research, please, and yeah, there's not only one way. There are many ways you can achieve your dream or whatever you want to, whatever your goal is. So yeah.
Absolutely. And that's another perfect example of how, as you said, Vasiliki, there's not one way to become an allied health professional or a support worker. There are many, many different ways to access these careers. As we've heard in our other panel sessions today, I think absolutely don't give up. Don't be disheartened. It's about so much more than the qualifications. You need to know what they are. You need to figure out the way that works best for you to be able to achieve those qualifications. But actually, it's about who you are and what you can bring to that role is really important.
Vicky, can I just come in on that? Because we had another question come through, and I think this is another piece that we've thought very much about our care skills and our clinical skills. But we've had a question in about what's a virtual ward and how does that impact on how you're delivering care in the community? So the big thing I would say in the last 5 years, more than anything, and brought again on or rapidly progressed through COVID, is the use of technology. Yeah, and how we've started to use technology. So if you're a bit of a techie, or you're really good on your phone and your computer and you're a whiz, tech skills are going to become a core part of how we deliver care. And so a virtual ward is very much, as opposed to bringing people into a physical space where you would have a ward with bays with beds in them and the team goes around, people are out in the community and the team services them through technology. So through interactions where they can do their blood pressure monitoring or monitor their oxygen saturation through tech in their home, and it feeds in to kind of sucked up into a portal, and that the team can review, and then you can confirm what you need, almost like a control center, a health control center. And then the team can decide each day, from reviewing the patients virtually, who do we need to go out to, what needs to be checked, how are we going to support this person, what decisions need to be made. So it's a combination of using technology to do monitoring, using technology to deliver care, either through interactions like this, so online interactions, as well as people being seen physically in a one-to-one in-person experience. So this is a new world that we're moving into. So technology is going to come with us. So you're going to have great people skills, but also have some understanding of technology into the future.
What an excellent question. Yeah, that's a really valid point. As Carrie said, you know, the community is not what it used to be. Things are changing, and technology is here to stay. That's something that the pandemic has changed, and we're not going to go back to to how we were sort of pre-pandemic. So that's a really excellent question. Wonderful. Do any panel members have anything else that they would like to share this afternoon, either in relation to the community or their role working with allied health professions, or should we wrap things up?
Just a couple of things, Vicky. I would say to you guys out there that are thinking about becoming an AHP or a healthcare professional, there are shadowing opportunities. So if you see something online, you think, what the hell is that? Or I don't understand that. Even if you Google it to, get in there, ring them up, ring them, say, oh, I'm a student, I'm a sixth form student, or, wherever you are, even if you're working part-time, to say, I'm really interested in this area of work, but before I apply, I would really like to see it in the setting. And it will give you that sort of experience, and you might go there and you might think, oh, actually that was really good, or you might go out there and you think, oh god, I don't want to go back in there. So really explore your opportunities, and don't be afraid to pick up the phone and just say, hello, my name is, always say my name is, and just say to them, I'd like to come, even if it's the half an hour drop in, would you be able to accommodate this? Really give it your all, be your best, and go out there and get a good job in healthcare.
Fantastic, thanks, Pip. Really important take-home message, I think, is if you like what you've heard today and you want to find out more, get out there, find ways to get experience, and we'll be sharing lots of different links in the chat for websites that you can have a look at as a starting point to find out more information, and see if you want to explore allied health and support worker roles anymore. That's brilliant. Thank you very much to all of my panel for joining us this afternoon, and thank you all for listening. Thank you very much.